New at 4 in today's Community Focus, fresh off of a marathon meeting of the House Energy and Commerce Committee, Massachusetts Congressman Jake Auchincloss joining me live now. Congressman, thanks so much for being here.
Good afternoon.
So that hearing, of course, was on President Trump's so-called Big Beautiful Bill, which we just heard about a little bit before the break. Pretty obvious, Congressman, that Democrats don't like this bill, but out of everything that's in there, boil it down for us. What do you think could have the biggest impact on the people here in Massachusetts and Rhode Island?
Bay Staters and residents of Rhode Island who rely on at-home care through Medicaid, whether because they're seniors or because they are families with children with intellectual disabilities, people who get health insurance through their employer and are going to be paying more for health insurance premiums, and anybody who's worried about going to the emergency room and facing a longer wait time. Those are all the effects that I think are going to make this bill very unpopular with the American people. I'll tell you, though, who does like this bill? Brad Smith. Brad Smith is a billionaire and a Trump donor who, because he was a billionaire Trump donor, got appointed to run healthcare for DOJ. And because of this bill, Brad Smith is going to get a tax cut, number one. And number two, the company that he runs on the side, which sells healthcare services to Medicare and Medicaid, will get to make more money and get to decide who does or doesn't qualify for Medicaid. This is the Brad Smith bill, and billionaires like Brad Smith like it, but people who rely on Medicaid for at-home care or get health care through their employer are not going to like it.
As we heard before the break, Speaker Johnson is pretty confident this is going to pass by the end of this week. Is there anything in there that you consider to be a positive thing?
Oh, sure. The Republicans put a number of bipartisan bills from last Congress into this bill. I'll give you one example, a Medicaid spread pricing ban, that basically cracks down on health insurance abuses of prescription drug pricing in Medicaid to save taxpayers money, to save senior citizens money on their copays. That's a good bill. I was a co-sponsor of it. I'm thrilled to see it get closer to passage, but it doesn't excuse kicking 13 million Americans off the health care rolls.
I want to hone in on a local issue. Somerset voters last night voted to enact a ban on homeless encampments on town property. They're not, of course, the only local community to do something like this. They're following in the footsteps of Fall River. Some cities and towns in Rhode Island have done similar things. Do you think this is in the best interest of public safety?
Yes, I support measures that uphold public order and the perception and the reality of public safety. I think a lot of Bay Staters and a lot of Americans broadly are sick of the disorder and threats that come from homeless encampments. I think people are sick of going to a CVS and having to wait 10 minutes to get a razor blade or mouthwash because they're all locked up. Lawlessness and panhandling, these are not things that I think are conducive to walkable, healthy downtowns.
I want to talk to you about the health of former President Joe Biden. We've learned, obviously, that he's been diagnosed with prostate cancer that has now spread to his bones. There's lots of buzz about this new book, Original Sin, that's out this week. Taking all of this into consideration and some of the new revelations that we've learned in just the last few days, do you feel like you and the American people were misled at all about his health and fitness in the last year?
Well, first, I wish the president and his wife and family the best. That is a painful diagnosis to receive, and I wish him health and happiness in the years ahead. I don't know that it's that useful for Democrats to continue to relitigate 2024. Pretty evident that the president should not have run again, and he should have made that clear sooner to give us the best possible shot in November of 24. But our focus now has to be November 2028 when it comes to the presidency and how Democrats are going to show Americans not just what we're against, but also what we are for.
Does his late-stage cancer diagnosis give you any concern about the health care that presidents receive?
No, there's no health interventions I'm aware of that can prevent prostate cancer, and the man is 82 years old.
All right, Congressman Jake Auchincloss of Massachusetts, that's all the time that we have, but thanks so much for joining us live here today.
Pleasure.